My name is Cindy Vickery, and I am a rehab nurse for Beaumont Healthcare Systems. And actually, it was a nursing friend of mine. Her husband had a very good experience working with Dr. Sorce. So I decided to come in. I'd already seen a different orthopedic surgeon who I was not happy with, and since I'm in the business, I know several. But I had not been real familiar with Dr. Sorce, and I came in and I was sold. Said he's the one. In my career, I do a lot of lifting and caring for patients, so both my knees were hurting quite a bit, and then it was gradually getting worse, but over a year. I just didn't want to slow down at work, and finally it gets to the point where the pain is where you say, you know, this is it. You're either going to have the surgery or you're going to have to retire. I had heard that Dr. Sorce was doing stem cells instead of actually orthopedic surgery on your knees, so I thought that would be a great option. I came in and checked it out, and I was tested, and I tested very well for the procedure to be successful. So I went ahead and had it done, and it was a great experience. So now he's going to work on my right shoulder. They go ahead and extract fluid from under your kneecaps, and then they send it to a lab to test for the markers to see if you are going to be a good candidate for the stem cell procedure. If you are, he lets you know, and then you come back in, and they go ahead and draw your blood and put it through a centrifuge and go ahead and extract the plasma with the stem cells and inject it back under your knees. And the stem cells actually scrub away the old cartilage that's damaged, and then they start to grow new cartilage. So it's a great procedure. I am a rehab nurse, so bilateral knee surgery is pretty complicated. There is quite a bit of downtime. You usually have to go to a rehab facility and go through at least 2 to 3 weeks of intensive rehab, and then you have healing time, and you're going to miss a lot of work. It's usually 6 to 8 weeks it can be for the surgery. I didn't really miss a day of work with the stem cell, and I totally recommend it. It's also a procedure that can be repeated unnecessary down the road, whereas a major surgery is a major surgery, and it's something that you think twice about having something like that repeated. So I'm looking forward to it because it will continually get better. He was great. He explained everything really thoroughly. He and his staff are both really laid back, easy to talk to, take their time, answer all your questions, and then also with my shoulder that Dr. Sorce is going to be doing some work on. He immediately, I told him my symptoms. He did a couple of tests having me raise my arm, and a couple other people I'd been to were like, oh yeah, you probably need shoulder replacement. He said, oh, I don't think you need shoulder replacement. This is what I think is wrong. And did the x-ray, did MRI, he was right on the money, 100%. Everything he told me was accurate. So I see a lot of doctors coming and going, and I really said, this is the guy I'm going to. I've told everyone who's thinking about having knee surgery or any kind of surgery that they need to come here and interact with Dr. Sorce and his staff. They're great. They call me all the time, check up, find out how things are going on, let me know what's going on with any test or anything they do. Very, very accurate and precise. Yeah, I'm just really, really happy. Pain-free.